let's transition to home safety in general for infants and toddlers. What are some of the biggest things that you recommend parents have as far as detectors, alarms, things in the home, not for the baby, but just for home safety in general when you're talking with new parents or expectant parents?
So, in addition to your smoke alarms and carbon monoxide detectors, um, I tell parents that they should have alarms on the doors, especially
Oh,
for the
yeah.
toddlers. They're pretty crafty.
Oh, they are.
So,
Yes.
you need to know if a door is opening that you didn't open. So, it's always nice to have something else that you can hear. Locks on cabinets, all of those things that they can grab that could cause, some type of harm.
And again, it's a lot of stuff. There's a lot of information.
Yeah.
We're always happy to do prenatal visits with parents and run through a checklist. And then not only again are we, going through it from a physician standpoint, but me as a parent now, I'm seeing how crafty and just straight up shady my kids have been. Um, and they're again very good at getting into trouble. And so I've learned more things that I add to my anticipatory guidance when I talk to these families.
Dr. Salazar, did you want to add anything?
Also, one recommendation is to be very careful that we don't have any like loose objects like a hair dryer close to the area where we're giving a bath to the baby, like little things, little accidents. So the cords actually are something that are very dangerous. Actually, going back to the crib, we want to be very careful that there's no loose cords there. Sometimes we have
Good point.
hanging toys. Those actually can be dangerous. It is also recommended to use a pacifier to sleep. But at the same time, we want to make sure that the American Academy of Pediatrics does not recommend that the pacifier when the baby is sleeping is attached to the cloth, because actually that creates some sort of tension, and that could be dangerous as well. So those little things. But going back to a little bit older kids, we want to be very cautious with medications. They have to be out of reach for little ones. We want to be very cautious at the kitchen with liquids that are used liquids that we use for other purposes that could actually a toddler can reach, can open and can drink. Those actually create a lot of accidents, intoxications. Unfortunately, I've seen those type of situations, and many times they lead to many complications. So those type of precautions are very important, because we want to make sure that our environment is safe for our toddlers as they progress basically on their development, exploration. And that's where like having those precautions, but also the adult supervision is key. And of course,
Yes.
we probably haven't mentioned much about it too, but animals too. So we want to be careful as well. Don't leave our little toddler with a dog unsupervised. That unfortunately I've seen serious accidents of bites, and like with a lot of complications for babies.
Yes. And something else to think about having in the home is firearms. I think a lot of people have guns and weapons in their home, and making sure that we have those in a safe place that is not accessible. I have had a gunshot wound, and the child, it was toddler aged. The gun was left in a pocket, and it shot across a room of children and missed everybody except for his hand, that child's hand. And that made the hair on the back of my neck stand up, how close that was to being just a catastrophic accident.
Yeah.
So making sure that guns, the safeties are on, they are not left out if you take a gun out to clean it. It's important to show the children, hey, this is dangerous. Talk about safety. Talk about
Hmm.
how dangerous those things can be. And talk about, when you're this old, we can talk more about it, or we can do the shooting range at this age. They do have gun safety classes for older children. The AAP recommends that the firearms in the home should be stored in a locked safe separate from the ammunition and unloaded. And so just being aware of those recommendations and being conscientious about it, because I think that a lot of people do have firearms in their homes for self-protection or for recreation.
Yes, and firearms, no matter what side of the argument you are for firearms, pro or against. We can all
Yeah.
agree that child safety is ultimate. That is a goal that we all strive for.
Absolutely.
So, what do you recommend for parents too when children, or even looking for a babysitter, that it may be in a home or going to somebody else's home? Do you have recommendations on how to talk about if there are firearms and ask questions to verify that they're safely stored?
I encourage parents from day one that this is your child and there's no such thing as being too um, aggressive and making sure that they are safe.
Mm.
So it starts with, we talked about earlier, there's lots of visitors for a newborn and everybody wants to hold the baby and kiss the baby. No, we're not going to do that because there are a lot of germs. So I would ask that everyone be respectful, that we're all going to wash our hands. And if you have a cold, please don't visit us right now. And so we continue on to
Yeah.
when we get to who's going to babysit or care for my child. You have a checklist of questions. And if they don't have the answers that fit your style of parenting or the environment that you feel you want for your child, then that should be someone that's not a candidate to
Excellent.
babysit. Because what they have in their home, that's their home, but you don't have to leave your child there. The other thing that I try to encourage people as far as firearms is that, of course, follow the recommendations that it's in a lockbox, the ammunition is separate. But if you have firearms and this is a regular part of your life, then I encourage them not to have toy guns in the house
Absolutely.
because it's hard for a
Good
kid to
point.
differentiate
Yes.
playing versus this is the actual thing.
Yes.
So if we're going to have firearms, then we're not going to have toys that look like firearms because that gives the kid a confusing picture.
If we are picky on other aspects of our life, why wouldn't we be picky about who is going to help us taking care of our child?
Yes.
Of course, nobody ever will do a better job than ourselves. But many times we have responsibilities. We have to go to work. We have to do other activities. So we want to make sure that we do our research. I mean, you don't have to be rude to actually ask the person like that all these safety cautions have to be taken care of,
Yeah.
but you want to make sure that you are basically that your child is in a safe environment.
And I always tell the families too, you are the voice for your child. You are the advocate for your child in every aspect. When they come in to see me and we're making a medical plan together versus picking somebody to help them take care of their child, you are their advocate, and that is your job. And nobody should make you feel bad for doing that job.
Definitely. And if they do, then maybe they're not part of your team.
Exactly.
Yeah.
It takes a village to raise kids, and we get to form that village.